If you're a resident of Canada, you are familiar with when you need to see a doctor or you get hurt, you take your provincial health care card. In New Brunswick, that's Medicare, and you head to the doctor or the hospital or wherever you need to go, and you present that card, and you do not need to pay out of pocket for the services that you receive. Now, this is guaranteed under the Canada Health Act. The Canada Health Act is legislation, federal legislation, that essentially guarantees that residents of Canada receive reasonable access to health care services and do not need to pay out of pocket for those. It is understood that the taxpayer money, tax dollars, go towards providing for healthcare. Now, we don't have a nationalized healthcare system. It is administered by the provinces. 10 provinces, 3 territories oversee the healthcare system in each of those jurisdictions. And so when you do any Google searching on healthcare systems, just in the world, whether they're public or private, you are going to see a lot of talk about universal healthcare, which essentially just means that tax money is used to fund the healthcare services that are received. And so the Canada Health Act is an example of that, where transfer payments from the federal government, federal taxes that are collected, are given to each of the provinces to administer their healthcare systems. We have 2 health authorities in New Brunswick called Horizon and Vitalité. We've talked about that weeks ago, I believe in July, previous parts. What we are saying here and what we are seeing now is that the Canada Health Act does not seem to be enough because 180,000 New Brunswickers do not have a family doctor. 7 million Canadians do not have access to primary care. Now, primary care is defined as point of contact, doctor to patient or nurse practitioner to patient. A healthcare practitioner is in direct contact with a patient, giving them the medical services that they require. This is why, and I'm going to draw heavily on Jane Philpott's work. She came out with a book recently called Healthcare for All. I do have the Penguin Publisher link in the description here. And she's arguing that the Canada Health Act was a lofty goal. It is definitely something that we are proud of on an ideal level. And yes, I can go down to the hospital or the doctor, present my New Brunswick Medicare card, and not have to pay out of pocket for x-rays or specialists or any of that care. And so that is something that we are grateful for as Canadians, but all of a sudden when we cannot get the basic care, when the primary care we need is not accessible to 20% of us, everybody seems to know somebody who does not have a family doctor or went to the hospital. I was knocking on doors this morning in St. Stephen and talked to a resident who went to the hospital with a serious ailment because he doesn't have a family doctor, and waited 4 hours in the emergency and just decided that was too long and left, and did not get access, that front door access to primary care. Now, COVID exposed a lot of the problems in the system. Jane Philpott, by the way, was the Minister of Health, and she is currently the Dean of Queen's Health Services at Queen's University. A very long resume in healthcare. She's a doctor, etc. She notes how new medical students coming into the system to be trained are deciding not to go into family practice or general medical practice. They are, the majority of them are choosing specialization to become specialists in a medical field. And so, like so many things, we are seeing a lack of doctors in the system contributing to this inadequate primary care. And she says that is because of the demands placed on doctors. They are just not wanting to go into family practice. And receive payment based on a per patient model. And then, of course, having to do charts all night long and on weekends, et cetera, et cetera. A friend of mine, when I was in university, her both her parents were doctors, and I saw what that was like. Always doing charts while watching television in the evening, in the on the weekends, and so a lot of new medical students are deciding to go into specialization instead of that. So what we need to see, and what she's advocating for, are centers where people have a medical home, and the medical home essentially means it's what we've been talking about as Greens for years, a community health center where your chart resides, your medical records reside, and you can go to that facility and be seen by a primary care practitioner, whether that is a doctor, doctors who are on rotation, whether that is a nurse practitioner based on your needs. And so that is what she is advocating for, because the shortage of doctors is contributing to this. And she thinks we need to go one step farther. And Greens have been talking about this for a while. Healthcare, primary care, not just reasonable access to health services, but primary care can be a right. And you see, Norway has done this. This is another example of the plans are out there, the models are out there. We just need to implement them. New Brunswickers can stand up and say, we are not going to settle for 20% of us not having access to what our taxes pay for, whether you're rural or whether you're urban. In Saint Croix, there are 20+% of us who do not have access to primary care. And if New Brunswick were to enshrine this as a right, and Norway did this, we would see, because it would be mandated and guaranteed, that everyone has access to primary care. So Jane Philpott is advocating for this on a federal level, but she wants to see this on provincial levels as well, because again, healthcare is provincially administered. We don't have a national federal healthcare system. It is provincial jurisdiction. I mentioned yesterday how the finger pointing happens. And so if we had a New Brunswick Primary Care Act, and Jane Philpott wants to work on a Canada Primary Care Act, it would guarantee that every resident of New Brunswick has access to primary care. And again, our taxes are paying for that, transfer payments are coming in, and we would see a very quick, radical pivot to making sure that when it is a right, that those services are delivered. Again, this happened in Norway, and now 99% of residents of Norway have access to primary care. That is the kind of thing we want to see. Greens have worked hard and successfully gotten the primary care that they need, the community health centers, et cetera, in their ridings. That is what I want to do for Saint Croix. That is a baseline. But what we want to make sure of is that, even when you get these centers up, they fill up very quickly. And then we have to get another one, or we're waiting for more staff. We basically need a complete pivot, a change in the system. And I'm going to wrap up here because of time. Tomorrow, I want to talk a bit more about what Greens have said about this, and relating to health, making a clean environment a right as well. That is, Greens are always fighting for your rights as a resident so that your life is better, getting the services we need.